Welcome to Psychiatric Nursing Lecture. In this video, we are going to see the classification of major depressive disorders. Also, we are going to see how to manage depression. What are the different types of management of depressive patients we are going to see. Let's start with the classification of major depressive disorders or depression can be classified into various types. The first type is atypical depression. The atypical depression is characterized by mood reactivity, that is called paradoxical anhedonia, and there will be significant weight gain or increased appetite. That is, the patient feels comfortable while eating, and there will be excessive sleep or somnolence, that is, hypersomnia will be present. But in other kind of depression, there will be sleeplessness, there will be lack of sleep. But only in atypical depression, there is excessive sleep. There will be sensation of heaviness in the limbs, that is called as laden paralysis. There is sensation of heaviness in the limbs called as laden paralysis. And there will be significant social impairment as a consequences of hypersensitivity to perceived interpersonal rejection. So the patient with atypical depression will have abnormal social conduct, that is impairment in the social relationship. This is due to the consequences of hypersensitivity to perceived interpersonal rejection. Because of the feeling of rejection, there will be abnormal social withdrawal. There is social impairment is present. This is about atypical depression. Now let's see the next type of depression is melancholic depression. Melancholic depression is very severe form of depression. It is characterized by anhedonia, that is loss of pleasure and failure of reactivity to pleasurable stimuli, and worsening of symptoms in morning hours. During morning time, the symptoms get aggravated, and early morning waking. Patient with melancholic depression will get up from the bed very earlier, like 3 o'clock, and does not have sleep. After that, there will be psychomotor retardation, movements will be decreased, and excessive weight loss because they don't eat much, and excessive guilty feeling will be there, low self-esteem, sense of doom. They feels that death is approaching, that is sense of doom, worthlessness, helplessness, and dread about the future. They have negative attitude towards the future. So these are the characteristics of melancholic depression. Now let's see the next type of depression is endogenous depression. Endogenous depression is also known as autonomous depression. It is due to unknown origin, endogenous. Means the cause of the depression is inside the body. It is unknown origin or internal process. It is because of any abnormality inside the body, and it is not associated with external event like any death of the loved one or any loss of object, any job loss or marriage problem does not cause endogenous depression. The cause is within the body itself. It usually occurs in cycles on and off. Sometimes the symptoms are present, sometimes the patient looks asymptomatic, and it does not respond to the drug and ECT. That is one of the main characteristic feature of endogenous depression. Does not respond to drug and ECT. Genetic and hormonal predisposition are contributing factors. In family, first degree relatives have this problem, there will be chance of getting the endogenous depression increases, and there is also hormonal imbalances like hypothyroidism, cortisol indeficiency, serotonin problem. So these things also can cause endogenous depression. These symptoms are more severe than the reactive depression, and it is difficult to diagnose, especially in children and adolescents. And often it will be there throughout the life period. The patient will have this problem. So this is endogenous depression, also called as autonomous depression. The next one is psychotic major depression. It is simply known as psychotic depression. It is a term for a major depressive episode. In this depression, patient will have psychotic features like delusion, hallucination also, and roughly 25 percentage of people who are admitted in the hospital for depression suffer from this type of depression only. and anxiety, fear, and nervousness will be more. Agitation and paranoia, suspicious thoughts will be more in this type of depression. Insomnia, that will be difficulty in falling and staying asleep. Patient will not have the sleep. Patient will have difficulty to get sleep and difficult to maintain the sleep, and there will be physical immobility and intellectual impairment is present, and there will be psychosis problem like delusion, hallucination, derealization. These things are common in the psychotic major depression. The next type of depression is catatonic depression. It is very rare and severe form of major depression like catatonic schizophrenia. This is one type of depression with catatonic features. Like patient will be mute always and there will be more stuporous movements will be there. That is patient maintains abnormal body posture in the time of depression for a long time. The patient is either immobile or exhibit purposeless or even biaser movements. Catatonic symptoms also occur in schizophrenia, manic episode, or it is due to neuroleptic malignant syndrome also. This type of depression can occur. You know, neuroleptic malignant syndrome is one of the side effect of this antipsychotic drug. It comes under extrapyramidal syndrome. So this is about catatonic depression. The next one we are going to see is postpartum depression, commonly in mother who gave birth. For children, postpartum depression comes after the delivery of baby. Postpartum depression does not have a single cause but likely result from a combination of physical and emotional factor. This cause is not only one factor, it have multiple causes like physical causes and emotional causes. Postpartum depression does not occur because of something a mother does or does not do. The cause is not rely on the mother's behavior. It have many factors like exact cause does not know. There may be the theory says that there may be estrogen level, progesterone, cortisol, thyroid hormone level drop very sharply after the birth. That may be the cause of postpartum depression. And symptoms includes excessive guilty feelings for giving birth to the baby, anxiety, more, and depressive mood, often hypersomnia, patients sleep for a long time. There will be suicidal thought and fatigue is very severe, and the mother cry often without any reason. So these are the noticeable symptoms which is associated with postpartum depression. Now the another type of depression is seasonal affective disorder. This is very common during winter and late autumn period, and it is because of the lack of sunlight. And another theory says that lack of serotonin is the main cause related to the seasonal affective disorder, and melatonin and serotonin production is affected because of the dim light and darkness in the which is there in the winter time. The pineal gland does not produce these hormones like melatonin. That is the cause for the seasonal affective disorder, and it is the symptoms are characterized by difficulty in waking up morning, and there will be decreased energy in the body. Anergia will be present. Carbohydrate craving. Patient tends to eat more carbohydrate rich foods. Increased appetite. There will be increased sleep because of increased appetite. There will be eating more carbohydrate foods will gain more weight, and there will be difficulty in concentrating in any activities because of the absence of these hormones, and the decreased libido, the sexual energy, the desire to have sexual affair will be decreased, and social withdrawal, and patient does not mingle with any member in the family and friends, and there will be depressive symptoms often present with anxiety and irritability. So these are seasonal affective disorders. Now, let us see the recurrent brief depression. It is a short form RBD. It is distinguished from the major depressive disorder, and it is having the duration varies between one individual to another individual. People with recurrent brief disorder have depressive episode about once per month, with individual episodes lasting less than 2 weeks and typically less than 2 to 3 days. So this is the main feature. The depressive symptoms will have at least two once per month, and individual episode lasting less than 2 weeks and typically 2 to 3 days. Diagnosis of recurrent brief disorder requires the episodes occur over the span of at least 1 year. So, like this, the problem should be there for at least 1 year. Once in a month, in 2 to 3 days, they must have depressive episode for at least minimum 1 year. And in female patient, it is very common, and it is independent of the menstrual cycle. So, this problem does not have relation with menstrual cycles. People with clinical depression can develop recurrent brief depression and vice versa. So, recurrent brief depression and clinical depression can develop one on another basis. So, both illnesses have similar risks. So, these are the major classification of depressive disorders. Now, we are going to see the management and treatment of depression. Pharmacotherapy, we have psychotherapy, we have electroconvulsive therapy. So in pharmacotherapy, the medical management of depressive disorder include first generation and recently developed second generation antidepressants are given. First generation antidepressants include tricyclic antidepressants and monooxidase inhibitor. These drugs we have discussed already in the antidepressant lecture. So the common tricyclic antidepressants and monoamine oxidase inhibitor I have mentioned in that lecture that you can write in the exam. And second generation antidepressant drugs which dominates the medical management of depressive disorders include selective serotonin reuptake inhibitor SSRI and select serotonin and norepinephrine reuptake inhibitor SNRI and selective serotonin and norepinephrine reuptake inhibitor SSNRIs. Other drugs with related mechanism of action that can be given to patient who is having depression to treat the various hormonal and neurotransmitter imbalances. And the mechanism of action of most of these agents is poorly understood, but the most likely work through their effect in the neurotransmitters such as serotonin, norepinephrine, or dopamine in the central nervous system. So these drugs mainly act over these neurotransmitter in the central nervous system. So this is about the medical management for depression. Now let's see the electroconvulsive therapy. Duration of electroconvulsive therapy is 6 to 12 cycles and frequency of the treatment is 3 times a week until a symptom improve. So at least 6 to 12 cycle you need to give electroconvulsive therapy at least 3 times in a week until the symptoms improve. You need to give the electroconvulsive therapy. The next one is the light therapy. Light therapy is a good treatment choice for depressive patient during seasonal affective disorder, and duration is 15 minutes to 2 hours daily. You need to give this light therapy. Usually you will give the ultraviolet rays. The patient has to sit in front of the ultraviolet rays, the light box, so when the light falls on the skin, the hormones like melatonin, serotonin, that imbalances will be overcome by the patients. So now next, the type of behavior therapy or psychotherapy is counseling is very essential because patient have low self-esteem, patient have feeling of helplessness, hopelessness, worthlessness, patient have poor self-esteem, poor attitude. So to overcome that, to teach the coping abilities, we need counseling, identification, resolution of current life difficulties, and reassurance and support is the main goal of the counseling the patient with depression. Now next see the next therapy is cognitive behavior therapy. We have discussed cognitive behavior therapy techniques, and main goal of the cognitive behavior therapy is to identification of the cognitive distortions and associated behaviors and cognitive restructuring. The negative thinking which comes in the mind has to be eliminated, and patients should be taught to develop a positive thinking. Various cognitive structuring techniques are used that we have studied in the cognitive behavior therapy. Those things are applied in this patient with severe depressions. The next type of psychotherapy is like interpersonal therapy. Interpersonal therapy was developed by Claremont and Weissman, and practically this is done for 12 to 20 sessions. And interpersonal therapy is done in 3 phases. During first phase, Information is gathered about the patient, assessment, history collection, mental status examination. Psychoeducation is done related to interpersonal problems and interpersonal inventory and chart and focus group discussion. All these things are done in the first phase to collect more information and to plan for further treatment. During second phase, the planning is done and work on the role transition, like what kind of role we exhibit in the society, in the relationship that we are developing, role transition, like how you need to adjust with the new roles in your life, and role conflict, how you can resolve with one another, what kind of conflict you have with your partner, with your co-worker, with your peer group member, how to resolve those things are taught in the second phase, and how to resolve the grief and what kind of interpersonal deficits a patient have, that things we are corrected in the second phase. And in the third phase we are focusing on the relapse prevention. The relapse prevention is the illness should not come again, for that we are focusing. And here the grief is resolved by means of some kind of crisis intervention is done. Sometimes we develop them how to feel independent when you develop the when you're going to new roles. Now the main ideas behind the interpersonal therapy is to solve the interpersonal problems. These interpersonal problems are central to many psychiatric problems. Many psychiatric problems are come because of the poor interpersonal relationships in their life. And interventions commonly given here, like link symptom change to interpersonal events and experiment with new interpersonal strategies. The strategies developed by the therapist will be implemented, and if that is effective, that is good. If it is not effective, we plan new the interventions to treat the interpersonal problems. So main indication for interpersonal therapy is depressive patients. The next one is, now family therapy is very important because the depression not only affecting the individual, it affects the whole family. So family therapy helps in effective change by addressing the dysfunctional aspects of family relationship. So in family therapy, the family therapist focus on resolving the depression which is affecting the whole family members. And it is also the steps are taken to prevent the depression is transmitting from one person to other family members, because the mood is very easily contagious from one person to another person. So these things are done in the family therapy. Now let's focus on the nursing management and the common nursing diagnosis for depressive patients I have mentioned here. You can see the nursing diagnosis in this video, and the nursing intervention you can see in the book for this nursing diagnosis, which are commonly developed for depressive patients. The common nursing diagnosis, first one is self-directed violence, because suicide is most common. The patient with depression can go for suicide. So that is the first nursing diagnosis. Risk for self-directed violence related to anhedonia, helplessness, hopelessness, social isolation, substance abuse, as evidenced by previous attempts of violence, suicidal plan, and suicidal behavior. So, write the nursing interventions, how to prevent the self-directed violence, how to improve the patient interest in the activities, how to develop the patient's ability to do that work independently, how to develop good interpersonal relationship. These kind of nursing interventions we need to write for this diagnosis. And the second important nursing diagnosis, impaired social interaction related to altered thought processes, anorexia, feelings of worthlessness, fear of rejection, lack of support, lack of support system, self-concept disturbances as evidenced by dysfunctional interaction with family, peers and others, verbalized discomfort in social situations. So, right nursing interventions according to the how to develop the patient good social relationship, how to change his thought process, how to give good energy for the patient, how to improve the person's self-esteem, how to develop self-concept. So how to improve the relationship with the family and peers, how to make the patient to verbalize their positive feelings about a social situation. So these things related nursing interventions we need to plan. The next nursing intervention common is disturb thought process because patient may have psychotic future that is related to anxiety or depressed mood as evidenced by impaired judgment, perception and decision making. So write the nursing interventions which can um, help the patient to change his abnormal thought process like cognitive therapy. We have seen various techniques. What kind of the techniques we can give to change the thought process we can write here. The fourth diagnosis is chronic self-esteem. Chronic low self-esteem related to feelings of shame and guilt as evidenced by repeated expression of worthlessness. So already we have seen what type of nursing intervention we need to write for a self-esteem improvement that you need to write here. Hopelessness related to losses, stressors as evidenced by inability to establish goals, loss of interest in life. So for this, how to help the patient to have good hope, how to change the patient negative attitude towards the self, others, environment, future. Related to that, you can write the nursing intervention. So refer the textbook for nursing intervention. In the textbook, nursing interventions are given with the rationale. So follow that and you can write it. So this is about the depressive disorder. Hope you all understood. So in the next lecture, I will discuss about mania. So mania is one of the important disease condition like schizophrenia and depression. So we will see that in the next lecture. Thanks for watching this video. Take care. Bye bye.